And now it's time for our hometown experts. It is very common to hear that you have an ovarian cyst, especially in your reproductive years. The good news is they can be treated. The Institute for Women's Health has some very helpful information. Take a look.
Hey ladies, it's Girl Talk, and today we're at the Medical Center Tower 2, and we're talking to Dr. Gonima, who's an OBGYN. So today we're going to talk about ovarian cysts, because us women, well, we have all those kinds of problems. So Dr. Gonima, tell me about ovarian cysts. How common are they?
Very common. Most women will have some kind of an ovarian cyst during their life, during their reproductive years. Starting when they ovulate, there's always a potential for a follicular cyst, which is the cyst that happens when you ovulate, to turn into something called a corpus luteum cyst that can be very painful and very large. And there's also a risk of developing other types of cysts that are not functional cysts but are growths that will only go away with surgical treatment.
Okay, so we're talking about a large group of women. So what are the symptoms we need to look out for?
Well, the timing of pain, pelvic pain primarily, is helpful in determining what kind of cyst it is. And it will usually happen about 2 weeks after your period or 2 weeks before the beginning of your next period. This is a pain of ovulation. If this pain progresses and gets worse, this may be something that needs to be checked out. Any kind of severe pain in the pelvic area should be checked out, as it could also be appendicitis, pelvic inflammatory disease. Also, pregnancy should be ruled out, because an ectopic pregnancy is a very serious problem that could at first look like an ovarian cyst.
Okay, so for us women, when we're experiencing pelvic pain, at what point should we say, all right, I gotta go get this checked out because it could be an ovarian cyst?
Well, anytime that the pain is severe, most women will know that it's time to be seen, because they have experience from the beginning of their cycles that they have pain. But if this pain is unusually severe, or if there's any nausea or vomiting related to it, or if it's debilitating to the point where they miss school or work, then they should come in and be seen.
Okay, so as a doctor, I'm sure you see a lot of these cases. Are most of them treatable?
They're absolutely very treatable. In many cases, we're able to treat them with medication, like a birth control pill. In some cases, it's required to go to surgery, and ultimately, we want to rule out things like ovarian cancers, which are very rare, but will begin by looking like an ovarian cyst.
Okay, Dr. Gonima, one last question. How important is it that us women come in and get checked for ovarian cysts?
Well, it's very important, because the earlier that they're identified, the less time that you will miss from work or school. And in addition to pregnancy and to general health screening, it's one of the most common things we see. And avoiding surgery is most easily done by coming in early.
Thank you, Dr. Gonima. Okay, ladies, ovarian cyst is something that could happen to all of us. It only takes a little bit of your time to come on over to the Institute of Women's Health and get it checked out, because there's always a treatment.
And if you would like more information on the Institute for Women's Health, they are on Floyd Curl Drive, Suite 900. They also have other locations. Their main phone number is 614-1000. ifwh.org is the website. And guess what? They're also on Facebook and on Twitter.